Today, after finishing the whole day's work, I thought before I go home, I must make this video, which I am planning since Diwali time, that I want to talk about noise-induced hearing loss. In this last 1 month, we have seen so many patients who came to us with abnormal sound, ringing sound in the ear, sudden reduction of hearing in one ear, headache, irritability, sound intolerance, and day by day these numbers are increasing. Now, why we get more such cases after Diwali is that acute and burst of sound and high intensity sound exposure from the sound cracker, which I absolutely discourage, and I don't support use of sound cracker. Now, few of these patients, they undergo actually temporary threshold shift. That means once the exposure is out and you come to the doctor immediately, we usually give sometimes steroid or other medicine and advise to avoid heavy noise. Slowly they get back their hearing, but few cases come who actually shows permanent loss of hearing. The hair cells in the inner ear is so damaged that they cannot revert back to its original position. Now, about noise-induced hearing loss, I also want to tell you that the crackers noise are very bad, we all know, but there are some seemingly innocent source of noise. They can equally damage your ear. What are the commonest source I am seeing nowadays is overuse of headphone, earphone, especially many young individuals, they are listening to music, watching series, and when they're traveling either in flight or office cab or bus or metro, because of the ambient noise they want to hear better, so unknowingly they keep increasing the volume. And this kind of exposure, when it goes every day 1 hour, 2 hour, 3 hours, medium to high intensity noise, that also damages your ear. When you will understand that, it will be too late. So remember that the intensity of sound and the duration of exposure are both important. So somebody who is a traffic police, who works in a factory in a very noisy environment, or a military personnel or an airport staff, they have to be very careful about this amount of exposure and the intensity of sound. So there are factory laws in India which says that what is the limit. Suppose 80 decibel is the limit. So if somebody is working under that condition, how many hours is permitted? And yearly once your hearing checkup is important. If the hearing test report is showing the hearing is coming down because of noise exposure, your authority must give you the protecting ear gears, must recycle or relocate you in a less noisy environment for few months before getting you back to the factory side. And regular follow-up and preventive measures can save you from permanent hearing loss. So the take-home message is, if any one of you who are regularly exposed to high level of noise, be it traffic noise, or you are working in a call center, for your profession you are bound to use headphone, earphone, be aware of intensity. Don't put the volume to the maximum limit. Try to keep it by 60 decibel. Do not expose yourself more than 60 minutes at a stretch. So remember this 60-60 rule, 60 decibel, 60 minutes, then take a break. And how do you identify the early hearing changes? Suppose you are feeling, I'm able to hear, but I'm missing the clarity. I'm missing few words, what is being said, or I'm not able to hear very clearly when I am surrounded by friends and people are talking together, when I'm in a meeting. So one-to-one conversation you may manage, but in a group call, in a group meeting, you are missing a few things. So these are the early indication of hearing changes or damage to inner ear. Do not neglect this. Come to your ENT doctor, get it checked, because if we diagnose early, we can prevent its further deterioration. Thank you.